Mr. Chairman, I'm glad we're having a hearing to talk about the skyrocketing price of prescription drugs. It's obviously a massive problem, and there are a lot of different things we could do to help. Senator Franken and I have a bill with a whole group of senators that has a whole menu of options in it. Senator Sanders and I have a bill with a group of senators to allow medicines to be imported, cheaper medicines to be imported from Canada. Those are things we should be talking about. But let's be blunt. It is insane to pretend to have a bipartisan hearing on lowering drug prices when right now, today, 13 Republicans are writing a secret bill to kick 23 million people off health insurance and their prescription drug benefits. And we can't even get a look at it. So let's start there. Dr. Anderson, you're an expert in health policy. Before the Affordable Care Act, if you bought a plan on an individual market, did it have to cover prescription drugs?
It did not.
It did not. And now the ACA requires that plans sold on exchanges cover prescription drugs as essential health benefits. Is that right?
Yes, those are essential health benefits written into the law.
Yep. All right, let's talk about a second part. Before the ACA, insurance plans could also impose annual and lifetime limits, meaning that once patients had run up prescription drug costs to a certain point, the patient, not the insurer, would be on the hook for all the prescription costs after that. Is that right?
Absolutely. And so people were being thrown into bankruptcy court as a result.
Okay, and let's talk about particularly who gets especially hurt. How do those out-of-pocket costs hurt someone with a disability or a chronic illness?
Well, they are the people that are taking most drugs. So if you have 5 or more chronic conditions, which is about 5 million Medicare beneficiaries, you're filling a prescription every week. And that is just exceedingly expensive.
Okay, so before we had the ACA, we lived in a world where insurance stopped for those who needed it most and stopped whenever anyone needed it most. I know the ACA's coverage of prescription drugs isn't perfect, but if the secret Republican plan is anything close to the House bill, then millions of Americans will lose their access to prescriptions. The Republican plan will also gut Medicaid, which means millions more won't get access to their medicine. In fact, I want to ask about Medicaid for just a second. While the federal government pays for prescriptions through a lot of different federal programs, the best deal is Medicaid. A 2014 GAO study found that TRICARE paid 34% more than Medicaid for brand name drugs. Medicare Part D paid 69% more. There are a lot of ways that we could lower drug prices. We could negotiate with Medicare, let Medicare negotiate. We could import cheaper medicines, and instead, the Republicans are talking about slashing the one government program that does a good job of keeping prescription drug costs low. So my question goes in the other direction. Mr. Chairman, I assume that you've seen the bill, and I'm not asking for details on this, but can we get some general outlines of the Republican plan? Will the secret Republican bill let insurance companies go ahead and drop prescription drug coverage or kick people off Medicare?
Senator Warren, I can't answer that.
I appreciate that. And you've been someone who's really tried to work in a bipartisan way on this issue. But this is just enormously frustrating. We're in here to talk about the importance of access to prescription drugs and the need to bring down the costs, at the same time that 13 people are negotiating in secret to take away prescription drug coverage from millions of Americans. I know that there are people who want to be able to work in a bipartisan way. I know that we've had our differences on this committee with Chairman Alexander and with others, but we try to sit down and work in a bipartisan way. We can't work in a bipartisan way if we can't see the bill. And what's happening right now to deny Democrats and the rest of Republicans access to this bill so that we can see the details, so that we can debate them out in public, so that we can have experts review them, so the American people can see them, to deny the opportunity to see any of that is just flat wrong. In fact, it's shameful. That's it for me, Mr. Chairman.